prevent the spread of COVID-19 in developing countries, the UK government and Unilever have launched the Hygiene Behavior Change Coalition, or HBCC, through public campaigns, education, training, and capacity building, as well as providing health and hygiene equipment. But how was inclusive HBCC to reach vulnerable groups such as people with disabilities and the elderly who have limited access to water and sanitation facilities and health services? Through support from the Program for Evidence to Inform Disability Action, or PENDA, the Center for Islamic Studies at the National University, in collaboration with the International Center for Diarrheal Disease Research, Bangladesh, conducted an evaluation study on the implementation of the HBCC program in Indonesia, which was carried out from January to July 2022 in North Jakarta and West Bandung District. The study was conducted through a survey of 360 respondents related to knowledge, attitudes, and hygiene behavior during the COVID-19 pandemic. In-depth interviews and photo voice ranking were also conducted with students and elderly with disabilities to get more understanding of their situation. The results of the HBCC evaluation study were launched in a public discussion on Monday, September 19, 2022. This event was opened directly by the Vice Chancellor for Academic Affairs, Student Affairs and Alumni, Dr. Suryono Effendi, and attended by the government representatives such as National Disability Commission, the COVID-19 National Task Force, universities, organizations of people with disabilities, HBCC program implementing organizations and NGOs. The HBCC program is sufficient to reach people with disabilities and the elderly, where more than 80% of respondents have received messages on changes in hygienic behavior, such as washing hands with soap, wearing masks, and maintaining distance. Around 60% have also received medical equipment in the form of masks and hand sanitizers. Television is the most important media for people with disabilities and the elderly to get information about COVID-19 and hygiene behavior to prevent the spread of COVID-19. The study also conveys a number of recommendations, including the inclusion of disabled and elderly groups is important, especially in public campaigns on hygienic behavior for pandemic prevention by providing information services, water and sanitation facilities, and inclusive health services. Funding institutions need to emphasize the mandate to consider groups of persons with disabilities, the elderly, women, and other minorities to promote organizational responsibility in designing inclusive programmatic interventions. The government should develop evidence-based policies to encourage sustainable hygiene practices among people with disabilities, the elderly, and caregivers as part of the Sustainable Development Agenda. Kiki Tarigan, a member of the National Commissions for Disabilities, appreciated the study because it provided real information about the disability situation in the field. This study is important for public awareness of data regarding disability groups and their needs, especially during the COVID-19 period. The chairperson of the National Commission for Disability, Dante Rikmalia, appreciated the novelty of this study, especially the use of photo voice ranking as a tool to understand the challenges and happiness faced by people with disability.
Saya berharap penelitian HBCC ini akan menjadi sebuah stepping stone atau batu pijakan bagi kita terutama di Indonesia di dalam melakukan sebuah pengambilan kebijakan yang berbasis riset, sehingga apa yang kita lakukan itu dengan adanya penelitian ini yang dilakukan oleh universitas berkolaborasi dengan lembaga-lembaga lain di luar negeri dan kita di Indonesia tidak ketinggalan, sehingga kita dapat menjadi salah satu negara yang dapat mengatasi atau membantu warga negara disabilitas yang kemungkinan masih belum mendapatkan perhatian yang serius dari lembaga ataupun negara di dalam memprioritaskan warga negaranya supaya mendapatkan hak-hak yang sama di dalam kehidupan mereka.
Secara umum kami sangat senang atas hasil yang dilakukan oleh UNAS ini, khususnya di PPI yang melakukan kajian terhadap penyandang disabilitas dan juga lansia. Ini adalah salah satu bukti pengarus utamaan isu disabilitas. Dari penelitian ini juga kita bisa melihat ternyata apa yang menjadi hal penting agar informasi, komunikasi, dan layanan itu dapat disampaikan kepada penyandang disabilitas. Kemudian siapa saja yang dapat berpengaruh agar informasi, komunikasi, dan layanan khususnya kesehatan dalam masa Covid pandemi ini bisa diterima oleh penyandang disabilitas, misalnya yaitu oleh keluarga terdekat. Kemudian media yang baik yang bisa memberikan informasi bagi penyandang disabilitas juga dapat ditemukan dari penelitian ini. Selain juga banyak hal-hal penting lainnya yang menginformasikan kepada kita semua tentang layanan bagi penyandang disabilitas.